absolutely delighted to be the sponsor for this award. The Royal College of Anaesthetists sponsors Anaesthesia and Perioperative Medicine Team of the Year award because we're determined to challenge the best perioperative clinicians, and that means you, healthcare workers of all medical specialties, because perioperative care is the golden thread which runs through the work we do when providing the best care for our patients. The winner for this year's Anaesthesia and Perioperative Team of the Year is the Gloucestershire Hospitals NHS Foundation Trust with their Medical Emergency Response Incident Team, MERIT. Huge congratulations. The judges said a protocol-driven team delivering the highest quality of care to the sickest. Their outcomes were identical to more highly resourced services, and this was a winning entry from a group of professionals whose whole approach was to ask other teams, how can I help? This is exemplified by the evolution of their roles. The remit of the team was originally a team to prepare patients for ITU. However, as they became more confident, they widened their scope to a proning team and helping with communications with relatives. This is a very scalable model. You lose a lot of elective operating during a pandemic, and this makes use of the available ODPs and anaesthetists. Gloucestershire was very badly hit at the beginning of the pandemic, not helped by its proximity to the super spreader Cheltenham Gold Cup event. Their approach to staff welfare was powerful, and they adopted the TRIM peer support system very early on. The judges also highly commended the Surgical Enhanced Care Unit delivered by Croydon Health Services NHS Trust. On behalf of the Royal College of Anaesthetists, huge congratulations to our winner, highly commended, and all the finalists this evening. Thank you very much. Back to you, Phil and Fee.
Thank you so much, Helgi, and congratulations to the Gloucestershire Hospitals NHS Foundation Trust. We're delighted that Henry Murdoch from the winning team is able to join us this evening. Welcome, Henry.
Hi, that's okay. You've got your mic on, so you're streets ahead on your technological expertise. Well done. I'm glad one's gone for the West Country. Tell us about what you learnt over the course of the pandemic. What changed between the first and second waves and how we manage critically ill patients?
We learned, first of all, I just wanted to say congratulations to all the teams who have got through to the final. I'm staggered and delighted on behalf of all of our team that we've won tonight. It's a real vindication of all the hard work that we all put in to try and get this team up and running and the outcomes we gained from it. And we certainly learned a huge amount throughout the whole process. And the key to the success, I think, was our continued reflection and evolution of our protocols. We looked at the way we as individuals worked with the patients, how we took feedback from the intensive care staff, and actually we've got quite a really good system for getting patient feedback from our intensive care unit, and actually that was really useful in terms of changing the way we worked, and in fact that changed the way we proned our patients from the first surge to the second surge to try and reduce brachial plexus injuries, for example. So that was just one example of how that was beneficial. But as I said, we evolved the service as well. So we're doing lots of other roles, a lot of transfers of patients, tracheostomies, and particularly the opportunity during the second wave of taking other trainees and staff from theatres to teach them and give them more experience on doing inter-hospital transfers and managing these sick patients, which I hope will help develop a legacy for the future.
Thank you so much, Henry. It's really inspiring, your expertise, but also how you shared it and trained others. I hope your team is all okay. Is morale okay generally in the team? You're doing all right now?
Yeah, we're fantastic. The irony isn't lost on me that I've spent the best part of 2 years trying not to get COVID, and I've been taken down by a cold this last week. But the team has been fantastic throughout, and it's really, this is an award for them, for the 14 consultant anaesthetists and the 27 anaesthetic and theatre practitioners who all volunteered at the start of the first surge, as you say, during the Cheltenham races, when we just didn't know what to expect, except we knew that there was a high mortality rate amongst healthcare workers, and so it was managing that fear and expectation. And I think this is probably a really positive thing to come out of what was very dark times and what was, very stressful and very harrowing at times. So, the morale this will massively boost our morale.
Right, that's great, Henry. Thank you very much. Congratulations to your team once again. And thanks for joining us this evening. We look forward to hearing about the next steps. Well done.
Thank you, Henry. And one of these awards will be heading its